Chicago Department of Public Health is issuing a warning over a local uptick in meningitis cases. So far, there have been 8 cases this year and 7 in 2023. 4 people have died. From 2017 to 2022, we had just 1 to 2 cases a year. Joining us now to discuss this is Dr. David Nguyen. He is an infectious disease physician at Rush University Medical Center. Thank you for joining us. Tell us what meningitis is.
Meningitis is an infection that infects the lining of the brain.
And how does it spread?
Well, in particular, there's actually several different types of meningitis, but the one that's of interest right now, the meningitis, it's spread through respiratory secretions, saliva, so can be spread through like kissing and close contact with those kinds of fluids.
What symptoms should people be looking out for?
Yeah, so people may start off feeling very just generally ill at first, fever, fatigue, things like that, but then they may develop neck stiffness, headache, maybe even trouble mentating, and then in some cases with this particular bacteria, because it enters through the body, through usually the nasal secretions, and then it gets into the blood, it may cause these like purplish lesions that are pretty characteristic of it.
Dr. Nguyen, why are we seeing a surge in meningitis cases now?
We're not really sure. Maybe we'll find out as the CDC and other public health authorities analyze the cases and data as time goes on. But, you know, you could think that maybe a lot of people did miss out on primary care during the COVID pandemic, the peak of it, and so they may have missed the key vaccinations. So, you know, parents should make sure that their teenagers get these meningococcal vaccines, usually given around 11 to 12 or right before college for 2 doses. And then anybody with an immunocompromising condition, a weak immune system, should also ask their doctors if they might need a dose of the vaccines.
Dr. David Nguyen, thanks so much for joining us.
Thanks for having me.
Thank you.